Hi, everyone, and welcome. Very, very excited to be here in conversation about the Helms Amendment and the future of global reproductive rights and health. Yesterday was International Women's Day. It's now Women's History Month. This is a new day. We have a new administration, new motivation, new activists in the US and around the world pushing for a racial justice reckoning, a gender justice reckoning, and real movement on reproductive rights for everybody globally. So today we're going to talk about how the US maintains an outsized influence in the world, particularly through our aid dollars and global health funding. And we're going to focus on one policy, which is the Helms Amendment. My name is Jill Filipovic. I'm a journalist, author, and lawyer. I cover reproductive rights and health for a bunch of different publications as a freelancer. I'm hopefully not going to be talking a lot on the panel, and instead we'll be asking questions of our incredible panelists. So we have Representative Schakowsky. We have Anu and Saba on the call, Anu Kumar, and I will let each of them introduce themselves, perhaps starting with Representative Schakowsky.
Thank you. Yes, I am Congresswoman Jan Schakowsky. I represent the 9th District of Illinois. I've been in Congress for 22 years and fighting these fights to make sure that women have reproductive rights, both at home and abroad. And as you heard, yesterday, of course, was International Women's Day. We're still celebrating that. This is the month of Women's History Month. And so it is time to take down the barriers that are protecting women all over the globe from having autonomy, controlling their own bodies, and of course, having a healthier and more productive life. The Helms Amendment is actually a little known act. We know about the Global Gag Rule that we're so happy that the President of the United States on the first day stopped the Global Gag Rule that prevented organizations, even with their own money abroad, to get any federal dollars. But the Helms Amendment, introduced by Jesse Helms, we'll talk about that in just a second, in 1973, shortly after Roe v. Wade passed, prohibits the U.S. Foreign Assistance Act from giving any money to a country, even where abortion is legal, to pay for abortions. And so it is time to repeal that amendment. A recent study by the Guttmacher Institute found that if the Helms Amendment were in fact repealed, that we would see 19 million fewer illegal abortions if, of course, the United States, the largest provider of healthcare around the world with our federal dollars, would repeal the Helms Amendment. And it would save literally thousands of lives of women who die because of the presence of the Helms Amendment and unsafe abortions. The real issue is that abortion is healthcare, and the Helms Amendment has now got to go. You know, Jesse Helms was a well-known and self-proclaimed, really, racist. And the Helms Amendment follows in that pattern. It is racist. The fact that brown and Black women around the globe are the ones who are primarily, and low-income women, poor women, are deprived of having the help of the United States of America for this procedure. As I said, even if it is legal in the country in which they live, United States dollars cannot go there. And so I have last session introduced Abortion is Healthcare Everywhere Act. And as of today, I am reintroducing that bill with a cadre of powerful women as the lead sponsors in the House and over 100 co-sponsors. This is a bill whose time has come, and I am looking forward to being able to pass it in the House, in the Senate, and sending to the desk of the President of the United States, who, by the way, were he to choose so, could also do an executive order that would remove the Helms provisions. But we have tremendous support in the Congress as well. So I'm going to yield back, and we're going to hear from a couple of women whose lives have been really built around this issue of women's freedom, autonomy, and reproductive health.
Thank you so much, Congresswoman Schakowsky, and thank you so much for your leadership and for being with us today. I'm Anu Kumar. I'm President and CEO of Ipas, and thank you, Jill, for hosting and moderating this session. We appreciate your presence. I'm joined here today by my colleague from Ethiopia, Saba Kidanemariam, who will be talking about the impact of the Helms Amendment in the lives of Ethiopian women in a place, as Representative Schakowsky mentioned, where abortion is legal. And the impact of the Helms Amendment is profound in that situation. Let me just provide a few kind of backdrop or context for what you just heard from Congresswoman Schakowsky. So as she noted, the Helms Amendment does actively discriminate against poor Black and brown women who essentially live thousands of miles away. Each day that the policy exists, the US is tacitly contributing to 35 million unsafe abortions that take place every year and tens of thousands of deaths and injuries that occur. It is a dramatic impact of this policy that's been around since 1973. And one of the reasons that Ipas, the organization that I lead, is active and cares about this issue is because we have also been around since 1973. And in fact, our genesis is a result of the Helms Amendment. And we're based in North Carolina, the home state of Jesse Helms. And so we have lived with this policy for nearly 50 years now. And this is the first time that with Representative Schakowsky's leadership and the leadership of other powerful advocates in the US Congress, it is the first time that this policy is being challenged. In nearly 50 years, just think about how many millions of women have been impacted by this over the years. So we're thrilled to be at this point, to even be discussing this. We're thrilled to have the possibility of its repeal in the House, in the Senate, and in the Biden-Harris administration. And the reason we're so excited about it is because of the impact that it has, and because of the possibility that this bill lays out for real US leadership on the issues of sexual and reproductive health and rights. I'm going to come back, Jill, and talk a little bit about the connections that Representative Schakowsky has laid out already about racism, the conversations that we're having in global health around decolonization. But I think it would be useful to hear from my colleague Saba first about the impact on the ground that she has seen and our colleagues in Ethiopia have seen on the Helms Amendment in a country where abortion is legal. So I'm going to stop there and maybe ask to turn to Saba.
Thank you, Anu, for the introduction, and thank you, Representative Schakowsky, for the leadership. And thank you, everyone, for being here. My name is Saba. I work with Ipas, as introduced by Anu. My organization works with a mission to have improved sexual and reproductive health and rights through enhanced access to and use of safe abortion and contraceptions. We work with the government and other partners in Ethiopia, ensuring reproductive health services are available to women and girls throughout the country. My country is one of the recipients of US foreign aid and thus directly impacted by the Helms Amendment. To give you some background on information on Ethiopia, on the abortion law, abortion is legal on some grounds in Ethiopia and has been since 2005 when the Ethiopian government expanded its abortion law. Abortion is legal in cases of rape, incest, or fetal impairment or and if woman's life or physical health is in danger, or if she is younger than 18 years of age. As you can see, it has so many conditions for women to access safe abortion. After liberalizing the Ethiopian abortion law, the government implemented programs designed to train healthcare providers, to equip facilities, and expand the services they offer, and to integrate abortion care into broader reproductive health services. These efforts have resulted in significant increased access to safe abortion, to post-abortion contraception, and a marked decline in trend of abortion-related maternal mortality and morbidity in the country. The contribution of unsafe abortion to maternal deaths has dropped from an average of 32% before 2005 to less than 9% in 2019. Despite liberalized abortion law and access to abortion services, women still have unsafe abortion. Lack of knowledge about the law and or stigma surrounding abortion and lack of access to services are the major reasons. The Helms Amendment restricts access to abortion even though it's legal in the country. This is out of step with international standards and the recognition of abortion as a human right and gender equality. It impedes progress and exacerbates existing barriers like stigma and creates medical and physical barriers. I have seen the chilling effect of this policy in my country, where abortion is legal, but confusion, misunderstanding, and inhibition around abortion care and information exist, and women are denied access to legal abortion services. Lack of clarity around US policy in effect bars health professionals from providing available services and prevent women and girls from receiving basic health information and services. Health professionals censor abortion-related information, and women and girls do not receive information and counseling on where to get safe abortion. It causes it causes fear among providers and health system managers who worry even associating with abortion services will jeopardize their US funding. This endangers women's health and exacerbates the stigma around abortion. Another barrier created by this amendment is health managers are forced to assign specific geographical areas to be assisted by USAID, leading women in some rural areas to be denied of abortion care. Thus, women and girls who are eligible per the law would have to travel to other areas many miles away to get abortion care. This entails more expenses or challenges to rural and poor women who cannot travel because of lack of funds or to other familial or social responsibilities. Women are discriminated against because they live in areas where health provision are funded by USAID. This restricts people's ability to make their own personal decisions and deny access to services.
Okay.
women
Wonderful.
and unwanted pregnancies will be forced to resort to unsafe abortion, endangering their health and lives. Helms Amendment prevents the most vulnerable women, poor, young, and victims of sexual violence from accessing the care they needed. So, in a nutshell, this is the kind of barriers the amendment creates in my country. Thank you.
Thank you so much, Saba. That was really, really useful and comprehensive. Really quickly, for any reporters or folks who are on the call, we're going to open up for questions at the end. In the meantime, you can always type your questions into the chat box, and I will turn to them toward the end of the discussion. But I quickly want to turn back to Anu. And Anu, first, I'm going to ask you to back up a little bit and just tell us what we're talking about. What is the Helms Amendment? What does it say? And then I'm wondering if you can dig a little bit deeper into some of the impacts that Saba touched on, but what are the other impacts globally?
Sure, thank you so much. Yeah, just another step, a little step back. Representative Schakowsky did mention this, but the Helms Amendment is an amendment to the U.S. Foreign Assistance Act, and that was originated in 1973 by Senator Jesse Helms of North Carolina, and it reads, quote, that U.S. foreign assistance funds cannot be used for the performance of abortion as a method of family planning. The language exists in the statute, and it's also as an amendment, as I said, to the Foreign Assistance Act, but it's also reiterated every year in the Department of State and Foreign Operations Appropriations Bill. So there is, as it's written, the Helms Amendment actually does allow for the provision of abortion information, counseling, post-abortion care, abortion in cases of rape, incest, if the woman's life is in danger. But because there is a lack of clarity, there is no clear understanding, as Saba was saying, the confusion on the ground about what it actually means. It has been interpreted as a total ban on abortion-related services and information. So in effect, it has meant that all of US foreign aid is off limits for abortion care and information. And this is separate and different from the Global Gag Rule. The Global Gag Rule is a provision which is an executive order, and it actually prohibits information, counseling, referral by recipients of U.S. Foreign aid from using their own private money for any abortion-related activities. So the gag rule, as we I think know, is reinstated usually in Republican administrations and then repealed under Democratic administrations. But the Helms Amendment is a constant. It has been in place since 1973 and remains in place. So that means that the impact of the Helms Amendment is quite profound. And so, and let me just lay out a few of the global impacts of it. I would say there are three major impacts. The first is financial. The second is around health and lives. And the third is really around the moral and ethical implications of it. So first of all, the financial, as I just laid out, it applies to all U.S. foreign aid. So for everything from development projects to humanitarian existence. So just as an example, the U.S. is I think the largest donor for the Rohingya refugee crisis. And as of October 2020, the U.S. contribution to that humanitarian crisis was $1.2 billion since the outbreak of the violence in that part of the world in 2017. But not a cent of that goes towards safe abortion care, even though the women who are in the midst of that crisis are experiencing very high levels of sexual violence. So it has very real financial implications. The second is around health and lives. As you've just heard from Saba and as Representative Schakowsky mentioned, there is a very real impact on the lives of millions of women around the world. Abortion is healthcare, and unfortunately, in many parts of the world, it's very difficult to access safe abortion care. And abortion rates are 2 to 3 times higher in lower and middle income countries. So rates of unsafe abortion are quite high. So unsafe abortion is abortion that's performed in unsafe conditions or by untrained providers. And there are 35 million unsafe abortions. And according to our partners at the Guttmacher Institute, if the Helms Amendment was repealed, there could be approximately 19 million fewer unsafe abortions and 17,000 fewer deaths every year. So it has a very real impact on lives. I think that estimate is actually an underestimate because of the way the analysis was done in the Guttmacher Institute, which I think we could expand on that. But even then, we can see the impact on health and lives. And then the final impact is that the Helms Amendment, repealing the Helms Amendment, allows the United States to bridge domestic and international issues, both on reproductive justice, but also racial justice. And it also allows the US to promote a positive vision for reproductive justice throughout the world through its US foreign assistance. It's hard to overstate just how out of step the United States has been with the rest of the world. We are the only major donor country that singles out and stigmatizes abortion care in its foreign assistance. And it's time for the US to really join other leaders, both in the global South, but also in donor nations to advocate and support a comprehensive vision of reproductive health and women's rights.
Thank you, Anu. And Representative Schakowsky, you touched on this in your opening remarks. The fact that we are in the US at this incredible moment of activism for racial justice here. We've seen the Black Lives Matter movement. We've also seen the Me Too movement having a reckoning for women and sexual harassment and violence. And I'm wondering if you can spell out a few more of these connections between racial justice action happening in the US, but all around the world, and what it means that there is a law that basically tells women overseas you can't access certain aspects of reproductive health care that are legal in your country because the US says so. What's the tie-in with racial justice?
Well, even in the United States, by the way, the number of women who die in pregnancy-related deaths, Black women, the average is about 4 times as many women die in pregnancy and delivery issues than white women. So there's a racial justice issue here. And we have set up now a task force to address this that I'm happy to be part of. And certainly around the world, it is just a fact that the most affected women are Black and brown around the world. And it makes sense to me that Jesse Helms would be the one who would understand that in 1973 and want to prevent any money going to those people. And so if we want to, and we have begun now under Joe Biden to rejoin the world, the Paris Accord on climate change, the World Health Organization, we're now part of once again, that healthcare does include abortion services. And I want to make this really important point that making abortion legal isn't the beginning of women having abortions. It's the end of women dying from abortions. It means that women will have what I think is the fundamental choice that describes their freedom, the right to control their own families. And they're going to, the size of their families, they're going to do that. And so the Helms Amendment and other restrictions doesn't necessarily, and we found it does not lower the number of abortions. It only lowers the number of safe abortions. Why would we be wanting to be part of the United States, to be part of contributing to women suffering and dying? So I think that there is this moral issue. It is about racial justice. It is about the right of women and our self-determination.
Thank you, Representative Schakowsky. Saba, I want to turn to you with a similar question. At the moment when Helms was being passed, it was also this moment of anti-racist action, not just in the US, but anti-colonial action, right, all across the world. And yet now, so many decades later, you still have a powerful country like the US essentially dictating what health workers in Ethiopia can do. And I'm wondering if you can talk a little bit about how that feels on the ground, what the impacts are, and if you see this through the lens of colonialism and racism.
Thank you, Jill. Yes, Ethiopia is an example of how the abortion controversy in the US continues to limit women's access to safe services, even in countries where it's legal. The Ethiopian government recognizes the need for comprehensive sexual reproductive health services, including abortion. Access to abortion, as I said earlier, is one of the ending maternal deaths due to unsafe abortion, but the US's anti-abortion restrictions curb progress. When US policies dictate what SRH services can and cannot be funded, it adds unnecessary barriers for healthcare providers and for women seeking legal abortions. This is direct discrimination, neo-colonialist in nature, and the US has imposed anti-abortion, anti-rights ideology on funding only related to one simple healthcare procedure, abortion. Post-abortion care is permitted under the Helms Amendment as indicated by Anu earlier on. So patients can procure unsafe abortions and then have consequences attended to with US funds. In the first place, equipment needed to treat the aftermath of unsafe abortion cannot be purchased with US aid. Second, why put women in harm's way and indicate that they can be saved when one deliberately prevents equipment for treatment? This is double standards, and that cannot be applicable in US national policy and is racial as it is discriminatory and harmful to poor women in third world countries, which are mostly Black and brown. So in its nature, it's racial discriminatory. And as described by the representative, I see it as in its racial form. So I agree.
Thank you, Saba. Anu, did you have any final thoughts on that question? Anything you want to add?
Just one thing, Jill. It's interesting that when the Helms Amendment was introduced, the Nixon administration at the time recognized it for being colonialist, and in fact did not support it. Nixon's own U.S., the staff at the U.S. Agency for International Development did not want the policy to be implemented and said that it ran counter to their attempts to decolonize foreign aid. So even at the time, it was recognized as being a policy of white supremacy, a policy of racism, and it remains that way. So it is long past time to get rid of this policy. Right now, we're having a really active conversation in the global health field about decolonizing global health, and to me, this is a really prime example of colonized global health policy.
Now, I just want to make the final point that despite the language of the original Helms Amendment that supposedly makes room for some abortions, it has been misinterpreted throughout its life and has really prevented nations from being able to apply or feeling that they can apply the money to abortion services of any sort. So it's really been a ban on US funding to nations in all circumstances.
Thank you. And Representative Schakowsky, I want to follow up with you on sort of a slight aside to that point, which is the question of the Biden administration. We have a Democratic administration in power. Obviously, your bill is front and center for what Congress could do on this issue. But what about Biden, and what about the executive branch? What's the universe of options there, and what are you feeling perhaps optimistic about in the face of this new administration?
Well, we did see the global gag rule eliminated promptly, and certainly a pledge by the President of the United States, Joe Biden, and Kamala Harris to expand freedom and participation around the world. So I feel optimistic that we will be supported by the administration with the legislation, and maybe even beyond, to have a executive order, or for the White House to take some action on its own. But right now, we are working hand in hand to enhance women's rights.
Fantastic, thank you. I want to ask Anu kind of a big picture question, and then a similar question to Saba about more specifics. So, in the face of the Trump administration, a lot of other countries, Sweden, Canada, Denmark, Norway, even the UK, began to scale up their funding for women's health and abortion access. If Helms was repealed and the US was able to fund abortion the way that, say, Sweden does, and maybe this is like the pie in the sky hope, but Anu, I want to hear from you what that would look like globally. And then Saba, I would love to hear from you what that would mean day to day, real time for the women you work with in Ethiopia. So I'll start with Anu first.
Thanks, Jill. So yeah, as you note, many countries are funding abortion. Sweden, Netherlands, Denmark, Canada, Finland, Norway, UK, many others. And what's interesting to me about the way they approach this issue is that they see abortion as part of a continuum of reproductive health, which is in turn a key component of women's rights, which is in turn a key element of human rights. Women's rights are human rights. And so these countries think of comprehensive reproductive health care, including abortion, as critical to the overall to the overall economic development of the countries that they're providing assistance for, and a very key feature of upholding human rights. So for them, it is part of their overall foreign policy objectives. From the big picture geopolitical point of view, this is how they approach it. And I think this is the way that we might be able to approach it in the United States, is to really think about how we can use the tools of foreign assistance to advance to advance countries and our relationships with countries. But one of the things that happens with the Helms Amendment is that the U.S. government is often not included in funding that occurs at a large scale level, to a health system. Or if it is included, it will impose these barriers around the Helms Amendment and the gag rule on that funding. And so it becomes very restrictive. So I think with the lifting of Helms, with the lifting of the gag rule, we could see greater international cooperation and a rejoining of the US in the global community that's actually thinking about abortion in a much bigger picture point of view, and connecting the dots between abortion and human rights and development and foreign aid. These are all related, and somehow in our foreign policy, we single this thing out and we make sure that women and girls are excluded, and that has a dramatic impact actually on our ability to be really powerful and moral leaders in the world. So I think it could dramatically shift, especially because we need to remember that the United States is the biggest family planning funder. So it's a big deal what we're able to do here.
Wonderful. Thank you, Anu. And Saba, I'm wondering if you can give us some kind of on the ground specifics. What would it mean for you if Helms was overturned?
Thank you. My country receives a considerable amount of funding from the US through USAID. In fact, the US is our largest donor for healthcare. It's about $6.7 billion per year. And reducing maternal mortality and morbidity is a major goal with this funding, around 800 million allocated for maternal and child care, which should have included family planning and reproductive health. But in Ethiopia, nearly 9% of all maternal deaths are due to complications from unsafe abortion. The Helms Amendment is applied as a total ban on abortion services and even information and counseling, so it essentially contributes to these injuries. Abortion is neglected area in health, and yet increasing access to it can save lives, as Anu said. So if US funding did not come with restrictions on or conditions around abortion, we can prevent around 1,200 women dying unnecessarily from unsafe abortion every year, because we can use all the funding coming from other sources as well, and the government funding together, and reintegrate it with maternal health care. This is in terms of financial impact. It may have the most important, it will help in curbing the stigma attached due to singling out abortion services from any other healthcare. Because when we talk about finance, it's about the financial implications, but it goes beyond the financial implications. When it is singled out, it reinforces the stigma around abortion. That is a major point which we need to underline as well. Imagine that women and girls could have access to the care they want and need. Imagine that because they would make their own decisions and realize their own potential. By repealing Helms, the US would signal its respect for Ethiopian women and girls and their rights. And it will join the rest of the world in respecting reproductive justice to women. Thank you.
Wonderful. Thank you, Saba. All right, we're going to turn to questions. I know there's already some in the chat box. So if you have questions, feel free to add them. The first one is for you, Representative Schakowsky. It's from Carolyn Kelly at CNN. And she wants to know, do you think there's sufficient support among Democrats for the Helms repeal bill? And can you speak specifically to what those numbers might look like? In other words, do you think this is a risky vote for moderates to take? Do you think it's a high enough priority for progressives, and thus something that might or might not advance to full House consideration? Oh, and Representative Schakowsky, you're muted.
There we go. Sorry. I believe that we can, that we will get the votes in the House of Representatives. We have a vast pro-choice majority now in the Democratic caucus. And I'm hoping maybe we would even get, you know, when I came to Congress, we had a bipartisan pro-choice caucus. That has pretty much disappeared. So it looks like we're going to have to rely on Democrats. But I feel confident that we will be able to have the votes. I think people have been accustomed now to expecting the removal of the Global Gag Rule, that's just and right to do, and that this is just an extension of that. And while lesser known, the Helms Amendment creates equal harm. And so I am very optimistic that we'll be able to move this. Women are on the move. There's no question. We have the majority in the the largest number, certainly not the majority, but than we've ever had in the House, and I feel good about it. Now the Senate is another matter, and that's where the filibuster becomes a real problem. And there's lots of robust discussion about the filibuster in the Senate right now, blocking all kinds, potentially at least blocking all kinds of legislation with what I think is really a small, undemocratic process. And if we can do something about the filibuster and have just a majority in the Senate, I believe that this is something whose time has come.
Thank you. And a quick follow-up, which I'm also going to ask Anu. This is from Roxy Zoll from Miss Magazine. What kind of battle do you think awaits in Congress for this bill? And what kind of messaging around Helms and the repeal of Helms have you found or do you foresee to be the most effective?
Good question.
So Representative Schakowsky, we'll have you go first and then I'll turn to.
Oh, okay. You know, I think we have discussed a number of elements. I think the issue of racial justice has really come to the fore. Here at home, the issue of maternal health has come to the fore, and those elements really propel the urgency of removing something that is so antiquated and has done so much harm, is so little known, and that we should be able to do this.
And I just wanted to.
Yeah, Anu, go ahead, please go ahead.
Thanks, Jill. Yeah, I just wanted to comment on the messaging point because we actually did do some public opinion research on the Helms Amendment not long ago and found that there is broad support on the American public for repeal of Helms. Americans believe that people in developing countries deserve basic health care, including abortion, and that basic health care does include reproductive health care and abortion. Americans believe that abortion should be accessible and safe, and that the consequences of creating barriers to access are really dire. And in fact, they know that they can lead to, loss of life and injuries. And Americans believe that everyone deserves autonomy. And that people should be free to make their own decisions. So what we have found in our polling actually is that Americans do support repeal of the Helms Amendment. They are not aware of it, which is a big, big problem, which is why we're so grateful to Representative Schakowsky for leading this effort and raising awareness about this. Because as I said earlier, the gag rule comes and goes and gets a lot of media attention when it does come and go. But the Helms Amendment is like the wallpaper. It's just there in the background. And it's constant, and we have become so normalized to it that generations, if you think about it, since 1973, there have been generations of women who've never even heard of it. But when Americans are told that this exists and these are the implications for foreign aid, they do not like it.
So Anu, we have another question in the chat that I think is a good kind of clarifier to that comment from Rose Wakikona, who asks, with the existence of the Helms Act, why do we even have the Global Gag Rule? It seems the two serve the same purpose. Can you speak to that, Anu?
Yeah, actually, they serve, they're reinforcing in the way that they act. So the Helms Amendment is as Representative Schakowsky has said, has been interpreted as a ban of the use of all U.S. foreign assistance funds for the provision of abortion care. So anything to do with abortion, it has been interpreted this way, that the U.S. foreign funds cannot be used for anything to do with abortion. Okay, the gag rule is essentially insult to injury. Right. So the gag rule says recipients of U.S. funds cannot even use their own private money to refer for abortion care, to counsel, to provide any information. So this is actually, a further restriction on a already very expansive restriction. The mechanisms by which these two are instituted differ as well. One is the Helms Amendment is a statute, while the gag rule is an executive order. But the end result, and this is something that Saba mentioned in her remarks, the end result is between the Helms Amendment and the gag rule, there is widespread confusion about what is possible to do with US funds. And so the default mode for most foreign organizations and governments is to do nothing, because they are worried that they will run foul of US ideology on abortion. And so they choose to do nothing on abortion. And that is very, very damaging to the health and lives of millions of people around the world.
Administratively, there's a difference. The Global Gag Rule refers to money that goes to NGOs, organizations that provide health care. The Helms Amendment, the money goes to a country and is part of the foreign assistance to that country. And so hand in hand, they both really limit the opportunity for women, for poor women, for women of color around the world to access the healthcare they need. You know, in some ways, I would say the fundamental battle is the definition of abortion not being included as one of the most important things, I think, in healthcare. Women being able to control their own bodies is so fundamental for their health, their mental health, their physical health. You know, the fact that it is the only thing that is excluded also really speaks to the discrimination against women.
Great, thank you, Representative Schakowsky. And I have one more for you. So President Biden has taken some important steps to promote reproductive rights globally. He rescinded the Global Gag Rule, which everyone expected him to do. He did that via executive order, no action in Congress needed. Why does Congress have to repeal the Helms Amendment?
Well, first of all, let me just say, the president has been president for, what is it, a month and a half now? You know, and we are doing the most extraordinary things this week in particular to address poverty. The bill that we're going to pass, the $1.9 trillion bill, will actually reduce poverty among children by half, and for adults by 25%. I mean, it's remarkable. So I am not going to fault the president right now for not moving unilaterally as the president to address this. I do fully expect his support for this this legislation, and hopefully even more to do an executive order if he can. I think it is a bit different to change the law than you know, to have to. This was an amendment to an act, and I actually am not sure. Maybe I'm not sure if you might know, others might know if it can be done by executive order. But you know, we certainly think that we're going to be able to move ahead, and the momentum is growing with the legislation. And I'm not sure, Anu, do you know if?
Yeah, it can be done. So we cannot have full repeal via executive action, but we can certainly, the Biden-Harris administration could instruct the State Department and other arms of the U.S. government to properly interpret the current Helms Amendment, so that it would include rape, acts, you know, incest, the health and life of the woman, and so be, you know, more would be better clarified. So yes, they actually can do something right now without congressional action.
My legislation would not only rescind and repeal the Helms Amendment, but it also would take a positive stance on the United States being committed to helping women on their reproductive health. So it's even more expansive than that.
Exactly. And that's why it's so important to have full repeal, but also a reassertion or an assertion, maybe not reassertion, but an assertion of a positive vision for reproductive justice by the United States. Absolutely.
Great. And Anu, this is a question that I think maybe you're best positioned to answer, from Barbara Crane, who says, thanks for this excellent panel on a critical issue. What coalition building is occurring with other organizations and networks in the larger development, women's rights, and faith communities? Helms could go in the course of a new foreign aid bill authorization, for example.
Yes, exactly. So yeah, we have this bill, as Congresswoman Schakowsky mentioned, now has 140 co-sponsors. So there are quite a lot of co-sponsors in Congress. We have over 172 organizations, advocacy and other organizations that are supporting the bill. And these are wide-ranging organizations. They're not just reproductive health organizations. There are groups in the immigrant justice movement, in the LGBTQ movement, in the faith community, those organizations that are working on gender-based violence. So we have a very wide support from a very wide group of organizations and constituencies represented. So yeah, I think that what we're seeing this time is really a groundswell of interest and support for doing something about this bill once and for all.
Great, thank you. And we have from Patrick Adams a sort of question / comment, which I think is really useful. So Patrick is highlighting that in addition to putting abortion access out of reach, Helms actively undermines post-abortion care. And I think probably Anu and Saba are two people that could speak to that. So Saba, I'm wondering, can you speak to that question of how Helms impacts not just access to safe and, in Ethiopia, legal abortions, but access to the kind of care that women need when they self-induce or seek out abortion from untrained freelancers?
Yeah, thank you. As I tried to say earlier on, because of the absolute ban on abortion, because of the misinterpretation, even post-abortion care, which is life-saving, is not provided because managers and providers are concerned, scared of losing their US funding. So they opted not to have any services related with abortion. That is one, because of fear and misinterpretation. But the other point is, for post-abortion, you need instruments, services, supplies. But with Helms, any country cannot use US funds for instruments related to abortion services. So by and large, in practice, post-abortion cannot be provided if you cannot allow governments to make use of the funds for instruments and supply purchases. How else are you going to provide services if you don't have the right instruments to provide services? So women would be dying unnecessarily, because of lack of services like post-abortion care, which should have been, provided anywhere because it's life-saving. So that's why it becomes very difficult for third world countries, because it complicates women's lives. They are forced to die for preventable diseases or interactions had there been any policy mandate to equip providers and make sure that they are able to provide. That's why it is so complicated, and it goes out of its boundary which is supposed to be, a ban on abortion, which should not have been a ban on abortion in general. Thank you.
Thank you. So we're running just up on time. So I want to give an opportunity for each of our panelists to give some brief closing remarks or thoughts. And Representative Schakowsky, I'll start with you. And you're muted. The trials of Zoom press conferences.
I'm sorry, and then I'm gonna have to get right off because I have another Zoom. But I am really grateful, so grateful to Saba and Anu and the work that they are doing to organize. I want to thank you, Jill, for hosting this event and moderating. The more people know about this, I think one of the obstacles we have in getting it passed is that people are unaware of the Helms Amendment. The fact that we have 140 people as co-sponsors is very, very encouraging. But we definitely have a ways to go, and there'll be an educational process as we move forward. So I am looking forward to protecting women and girls here at home and around the world, expanding our rights, making sure that we have the health care that they need and that we save lives. So with that, I thank you all for participating. Thank you.
Thank you so much.
Thank you so much. Let's go to Saba and then we'll end with Anu if that works.
Yes. As I was saying earlier, the Helms Amendment has created with a total ban on abortion because third world countries cannot use US funding for abortion. So this creates complications on the ground in terms of confusion and sending a message to all third world countries that abortion should be stigmatized. Abortion is not a health care. So it is complicating women's and girls' life in the world. Because of this, women are dying unnecessarily, and because of this, many injuries are happening to women and girls. So I urge the US government and partners who are working on this to get rid of this very old neo-colonialist amendment and join the other countries who are working on expanding reproductive justice in the world, and to send a good message to the third world countries that the US cares about their life and their health. Thank you so much.
That was great. Yeah. So I know we're out of time, so I'll just be very brief. So, the Helms Amendment has been around for 50 years. It's been used and interpreted as a total ban, as Saba indicated. And that has meant that the United States has essentially tacitly contributed to the deaths of thousands of people due to lack of critical health care. And that's just wrong. And it's time that it gets undone. So, I'm excited that we're talking about this. And I'm happy that this conversation is occurring in the context of a national conversation about racial equity. And the need for the United States and the rest of the world to really eradicate racism and contend with the legacy of white supremacy. And in our field, there is no greater legacy of white supremacy than the Helms Amendment. So it is time, it is well past time for this amendment to be repealed and done away with. Thank you.
Thank you, Anu. And we're gonna, excuse me, we're gonna leave it there. Thanks to everyone who watched, who asked questions, who participated, particularly the panelists. For the journalists and reporters on the call, I know Ipas is great at responding to questions. And so if there are other follow-ups or you wanna connect with folks in the field like Saba, who see the impact of Helms every day, Ipas is a great resource to reach out to. So thank you so much for being here, and I look forward to continuing this conversation going forward. Bye.
Thanks, Jill.
Bye. Thank you, Jill.